చూడండి దాంట్లో కనిపిస్తుంది. ఓకే, మీరు క్లాస్ తీసుకునే ముందు నాకు ఒకసారి కాల్ చేయండి సార్, నేను మెసేజ్ పెట్టేస్తాను వాళ్ళకి. ఓకే, సో దే విల్ కమ్. ఓకే. So this class is introduction to GAT, and of course we have included salary glands also. So the digestive system consists of gastrointestinal tract and many glands associated with digestion. So it is having a tract. The gastrointestinal tract means the musculotubular, epithelio-musculotubular structure, which starts from the mouth and ends at the anus, and it is attached with many glands, the secretions of which assist in digestion. So this gastrointestinal tract extends from mouth to anus. Structurally, it is designed for. So, what are its functions and how it is designed to accommodate those functions? Its functions, number one is degradation. So that is solid. The food that is placed in the mouth is first masticated by the action of tongue and teeth. Here the food is broken into small pieces, and the process of digestion starts here by the enzymes present in the saliva. So the first function of this gastrointestinal tract is degradation, which is starting in the mouth. So the food that is placed in the mouth is first masticated. That means is grinded, like we put something in the grinder and make it small pieces or make it a paste. So that work is done in the mouth by the tongue and teeth. Okay, teeth are grinding. What is the action of tongue here? Tongue is pushing the food in between to the place in between the teeth such that it can be ground. So now, because of this action of the tongue and the teeth, the food is broken down into very small pieces, and in order to avoid friction, in order to make this grinding easy, as we add water to the grinder, here also the saliva is secreted by the various salivary glands like the parotid gland, submandibular gland and sublingual glands, and it is added to this food that we have kept it in the mouth, such that it is easily made into paste and easily turned around in the cavity, oral cavity. Next, digestion. So that's about the degradation. So in the degradation, the process of degradation, what the thing is happening is the food that we have taken is made into is ground into small pieces or even paste, and it is added with saliva to make it easy for grinding, and then from there it goes into the next part, that is the pharynx and esophagus. And here, because we are adding saliva to this food, the digestion is started by the enzymes that are present in saliva. So the enzymes present in the saliva act on certain part of our food, and thus the digestion has started. Now the second part is digestion. So digestion has already started in the mouth, and it will continue in the stomach by the acid secreted here and by the enzymes secreted here. So in the stomach we are having secretions of the acid and enzymes which are continuing the process of digestion. Next, the process of digestion continues in the duodenum and small intestine by secretions of liver and pancreas that are added to the duodenum. Second part of the duodenum, there is a pancreatico-duodenal duct. No, the hepatopancreatic duct. the hepatome, that is liver, pancreatic duct, opening into the second part of the duodenum. And of course, the small intestine is having its own glands, which is also secreting the enzymes. So these enzymes are acting upon this already partly digested food, and the digestion is continued. Then the process of absorption, this starts simultaneously in the stomach, duodenum and small intestine, where the end products of digestion are absorbed. So here, once the food is deglutiated and then digestion starts. Digestion is started by the enzymes of the saliva, by the enzymes of the secretions of the stomach, and by the enzymes secreted in the small intestine, and at the same time by the secretions of the pancreas and liver that are poured into the duodenum, second part of the duodenum. So all these are helping in digestion of the food that we have taken. Then the process of absorption starts simultaneously in the stomach, duodenum and small intestine, where the end products of digestion are absorbed into the blood and carried to the liver, where they are converted to stable forms and sent to the sites of storage and utilization. So the process of absorption starts in the stomach. So in the stomach, what is getting absorbed? The water soluble parts of the food that we have taken, some medicines or some, the products of the carbohydrates which are acted upon by the enzymes present in the saliva already. So these things are absorbed, and of course water is also absorbed in the stomach. Then in the duodenum and small intestine, of course, the enzymes of the liver, enzymes of the pancreas, and enzymes of the small intestine, all these are acting on the basic elements that are present in the food, and they are being digested and converted into absorbable form, which are absorbed in these structures, that is the stomach, duodenum, and small intestine, and then they are going in the bloodstream to the liver, where they are converted to stable forms and sent to the sites of storage and utilization. And finally, in the large intestine, the remaining water part is absorbed and the residue is stored in the sigmoid colon and finally expelled when suitable environment occurs. So, in the large intestine, that's almost the last part of the intestine, GIT. We are seeing that the water that is in excess is absorbed back and the residue is stored in sigmoid colon and of course finally expelled when suitable environment occurs. So the parts of the digestive system, this is the very important question. Most of the time you will be getting name the parts of the digestive system, and then they will be asking you write about the stomach, write about the esophagus, something like that. So it's a major part. So now we have enumerated here 20 parts of the digestive system. You have to by heart all these things, and you should be able to reproduce these 20 parts whenever you are answering the exam. So now, starting from the mouth. So in the mouth we are having a tongue and teeth, then pharynx, then esophagus, then stomach. After stomach we are having a small intestine which is having 3 parts: duodenum, jejunum, ileum. So starting from the mouth, in the mouth we are having tongue and teeth, then after mouth we are having pharynx, then esophagus, then stomach, and in the small intestine duodenum, jejunum and ileum. Of course here we are showing this is the duodenum and this part is the jejunum and last part is the ileum. And then in the large intestine we are having a cecum, vermiform appendix, ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, rectum and anal canal. 10 parts in the large intestine itself. So you have to by heart all these things. Now in the figure we can show, see here we are starting from the esophagus, but before the esophagus we are having mouth, wherein we are having teeth and tongue, then the esophagus, then the stomach, esophagus, stomach, then the duodenum, that is the C-shaped duodenum, wherein the concavity of the C, the pancreas rests, and then the jejunum, ileum and the cecum, that is the big sac-like structure, cecum, then vermiform appendix, then ascending colon, hepatic flexure, then the transverse colon, splenic flexure, descending colon, sigmoid colon, rectum, anal canal, and anus. So these 20 parts you have to by heart and should be able to write whenever you are asked. Then each starting oral cavity, we are dealing with each part. The oral cavity is divided into outer vestibule, which is a narrow space between the lips and cheek outside and gums and teeth inside. So when you close your mouth completely and blow, so what you are saying, you are seeing your cheeks are ballooning out, and you will be seeing a space between your. Okay. So the parotid duct opens into it opposite the crown of the upper second molar tooth. Vestibule. So this part of this mouth vestibule is lined by mucous membrane. So here we are showing this part, the space between the cheek and the teeth and gums inside and outside the cheek and lips. This part we are calling vestibule. And the parotid duct that is coming from the parotid gland is opening into the vestibule at the level of the crown of the second upper molar tooth. Oral cavity proper. So when we open the mouth, that is the oral cavity proper, it is bounded anterolaterally by the teeth and gums and alveolar arches of the jaw. So oral cavity we are seeing it is bounded by teeth and gum and alveolar arches of the jaws on either side. The roof is formed by the hard palate, which separates it from the nasal cavity. So the roof of this oral cavity is formed by the hard palate, which separates it from the nasal cavity. The floor is formed posteriorly by the dorsum of the tongue and anteriorly by the sublingual region. So it is not a rigid structure, it is having some muscles in the sublingual region, and posteriorly it is formed by the tongue only. Gums are soft tissue which support the teeth. So gums are the outer borders. Teeth. So the teeth are the structures that help us in grinding the food that we have taken, that is in making the food into small pieces that we have taken. And these teeth are two types. Deciduous or milk teeth, which erupt from 6 months onwards and followed between 6 to 12 years. That means during this time they are replaced by the permanent teeth. And they are 20 in number, about 2 incisors, 1 canine, 2 molars for each half of jaw. So the decidual teeth or milk teeth are present in childhood, which erupt from 6 months onwards and followed between 6 to 12 months. That is, they are replaced by the permanent teeth during that period, and they are 20 in number and divided as 2 incisors, 1 canine and 2 molars for each half of jaw. That means for a full jaw it will be 10 and total it will be 20. Permanent teeth, these are about 32 in number, 2 incisors, 1 canine, 2 premolar and 3 molar teeth on each half of jaw. That means for the mandible it will be 16 teeth and for the maxilla it will be 16 teeth. So totally 32 teeth. Of these, the last 2 molars will erupt at puberty. That means till the age of 16 or 17 years, the teeth will be only 15 for each jaw. So after that, that will be developing, 14 for each jaw. After that, last pair will be coming, making the total 32 teeth. Tongue. So tongue is the muscular organ situated in the floor of the oral cavity and oropharynx. So tongue is extending from oropharynx into the oral cavity. It is a muscular organ. That means there is no bone inside the tongue. It has a ventral surface connected to the floor of the mouth by frenulum, and dorsal surface is, so tongue is having a ventral surface, a dorsal surface. The ventral, that is we say the underneath the tongue, is connected to the mouth by the frenulum, whereas the dorsal surface, superior surface of the tongue, is divided into an anterior 2/3 and posterior 1/3 by a V-shaped sulcus terminalis. So the dorsal surface of the tongue shows a V-shaped sulcus terminalis, which is dividing it into anterior 2/3 and posterior 1/3. There are three main types of papillae on the anterior part. They are filiform, fungiform and circumvallate papillae situated in front of the sulcus terminalis. హలో చెప్పండి. కాదు వాళ్ళ డాడీ. So the tongue is a muscular organ situated in the floor of the oral cavity and oropharynx. It has a ventral surface connected to the floor of the mouth by frenulum. The dorsal surface is divided into anterior 2/3 and posterior 1/3 by V-shaped sulcus terminalis. So this, the dorsal surface of the tongue is having a rough surface, which is due to the various papillae that are present. The papillae are filiform, fungiform and circumvallate papillae. The filiform papillae are like bristles and they are used in gripping the food. That means we have to grip the food in order to push it in between the acting teeth. That means in order to make it into small pieces, the food has to go in between the teeth, and that work is done by this filiform papillae of the tongue. Then fungiform papillae and circumvallate papillae are having taste buds in it such that they are helpful in tasting the food. The mucous membrane of anterior part of the tongue is supplied by chorda tympani branch of facial nerve. So the mucous membrane of the anterior part of the tongue is supplied by the chorda tympani branch of the facial nerve. Filiform papillae are bristle-like and help in gripping and moving food in the oral cavity. So that is the function of the filiform papillae. These facilitate mastication by the monarch. Fungiform papillae are having taste buds and salivary glands to assist in tasting. Circumvallate papillae are also helpful in taste sensation. So we are having three types of papillae: filiform papillae, fungiform papillae and circumvallate papillae. The filiform papillae and fungiform papillae are arranged irregularly over the whole of the dorsal surface of the anterior 2/3 of the tongue, whereas the circumvallate papillae are arranged in front of the sulcus terminalis in a row. And of course, the filiform papillae are useful in gripping the food and in moving the food in the oral cavity, whereas the fungiform papillae and circumvallate papillae are having taste buds such that they are helpful in tasting the food. So here we are showing the dorsum of the tongue, wherein the anterior 2/3 is showing the various papillae, the filiform papillae in the tip mostly, and fungiform papillae a bit wider ones, and then the circumvallate papillae. That means they appear as they are present in wells. So the papillae are surrounded by well. So we are calling them as circumvallate papillae, which are arranged in front of the sulcus terminalis. This is the sulcus terminalis. Of course, we are seeing the foramen cecum here and posterior one third of the tongue, wherein most of the lymphatic structure is present, which we are calling as lingual tonsil. And then, of course, the anterior surface, we are seeing so many papillae, the filiform and fungiform papillae, and there is a median furrow. Of course, this median furrow, which is present in normal persons, will not be there in people suffering from the Marfan syndrome, and that is a characteristic feature there. And of course, the ventral surface of the tongue, we are seeing the frenulum that is attaching tongue to the floor of the mouth, and we are seeing the submandibular gland ducts on sublingual papillae. So here we are seeing the ducts of the submandibular gland opening, and of course we are seeing number of sublingual glands. So that is the tongue. So wherein we are having a dorsal surface, a ventral surface. The dorsal surface is having anterior two-thirds, anterior two-thirds with many papillae, and of course there is a row of circumvallate papillae in front of the sulcus terminalis, which is dividing the tongue into anterior and posterior parts, and the posterior part is having most of the lymphatic structure, we call it as the lingual tonsil, and then the anterior surface is having the filiform papillae, fungiform papillae, and of course circumvallate papillae. Circumvallate papillae, that means we call them because they appear as they are present in bell, surrounded by bell, circumvallate papillae. And then the ventral surface of the tongue shows the frenulum, which is attaching the tongue to the floor of the mouth, and then on either side of the frenulum we are seeing the orifice of the submandibular duct on the sublingual papillae, and then of course we are seeing the various muscles that are present in the tongue and other things. Anterior lingual gland, okay, deep lingual vein, lingual nerve, deep lingual artery, hyoglossus, inferior longitudinal muscles, genioglossus, submandibular duct. Okay, so here we are shown certain muscles of extrinsic and intrinsic. The inferior longitudinal muscles and superior longitudinal muscles, the transverse muscles, are the intrinsic muscles of the tongue, which change the shape of the tongue, whereas the genioglossus, palatoglossus, and others are the external muscles which are moving the tongue. So posterior part of the tongue is supplied by the internal laryngeal branch of the vagus nerve. Muscles of the tongue, intrinsic and extrinsic. The intrinsic muscles alter the shape of the tongue. So I told you the intrinsic muscles are the longitudinal muscles, the transverse muscles, as well as the vertical muscles. So these muscles change the shape of the tongue such that it can move freely in the oral cavity. The extrinsic muscles bring about the movements of the tongue. So genioglossus, hyoglossus, styloglossus, and palatoglossus. These are the muscles that are coming from the outside and attaching to the tongue. So here we are saying genioglossus, what is the from the genial tubercle of the mandible to the tongue, whereas hyoglossus from hyoid bone to the muscle, styloglossus from styloid process to the tongue, palatoglossus from the palate to the tongue. So these are the muscles that are present from starting from outside and ending in the tongue. All the muscles of the tongue are supplied by the hyoglossal nerve, except palatoglossus, which is supplied by the vagus nerve. So all these muscles of the tongue are supplied by the hyoglossal nerve, and palatoglossus muscle is an exception, which is supplied by the vagus nerve. So that's about the oral cavity. So in the introduction to gastrointestinal system, we have first learned about the functions, various functions of the gastrointestinal system. First, where it is present is the action from mouth to anus. It is a epithelio-fibromuscular tube, and it consisting of various parts. The various parts of the gastrointestinal tract, which we should by heart like anything are about 20 in number, starting from the mouth, wherein teeth and tongue are present. Then we are having the pharynx, we are having esophagus, stomach, then the small intestine, that is the duodenum, jejunum, ileum, and large intestine, starting from cecum, vermiform appendix, then the ascending colon, hepatic flexure, then transverse colon, splenic flexure, descending colon, sigmoid colon, then rectum, anal canal, anus. So these are the about 20 parts of the large intestine which you have to by heart and write in the exam. Then starting with the mouth, we are having the teeth and tongue in the mouth. Teeth are about two types: the deciduous teeth, that is the temporary teeth, and permanent teeth. Deciduous teeth are there during the first 6 months to 12 years. During which time they are being gradually replaced by the permanent teeth. Deciduous teeth are about 10 for each jaw. That means 2 incisors, 1 canine, and 2 molars on each half of the jaw, and 5 plus again 5 that is a 20 above. Deciduous teeth are 20 in number in total. Then the permanent teeth are about 32 in number: 2 incisors, 1 canine, 2 premolars, and 3 molars. Out of these 3 molars, last pair of these molars are called wisdom teeth. They are coming at about the age of 16 to 18 years. And then tongue. Tongue is a muscular organ that is present occupying the oral cavity. It is having a dorsal surface, a ventral surface. The dorsal surface of tongue is divided into anterior 2/3 and posterior 1/3 by a groove-like structure which we are calling as sulcus terminalis. This sulcus terminalis is dividing the tongue into anterior 2/3 and posterior 1/3. The anterior 2/3 of the tongue is having various types of papillae. Papillae means the projections. Papillae are making the ventral surface of the tongue rough. They are filiform papillae, fungiform papillae, and circumvallate papillae. Filiform papillae are bristle-like structures that are present around the tip of the tongue, which are useful in gripping the food and moving the food in between the teeth such that it can be ground very easily. And then of course fungiform papillae and circumvallate papillae are having taste buds inside them such that they help in tasting the food. The circumvallate papillae, they get their name because they appear as papillae present in well, surrounded by a groove. So circumvallate papillae are present just in front of the sulcus terminalis, arranged in a V shape. Then the ventral surface of the tongue is having a frenulum which is attaching the tongue to the base of to the floor of the mouth, and it's also having the opening of the submandibular glands on either side of the frenulum. Of course, there are plenty of submandibular glands on the ventral surface of the tongue and various parts of this oral cavity also. Now we talk about the salivary glands. There are 3 pairs of salivary glands, namely parotid, submandibular, and sublingual. Secretions of these glands are carried into oral cavity where they are used in digestion. I told you in the beginning itself. Okay. Parotid gland, it is the largest salivary gland, situated in front and below the external acoustic meatus. Each gland is pyramid in shape and presents apex, base, and 3 surfaces: superficial, anteromedial, and posterior. Okay, so we are describing the parotid gland, one of the salivary glands, which is the largest of the salivary glands. It is situated in front and below the external acoustic meatus. The gland is pyramid shaped and presents apex, base, and 3 surfaces: superficial, anterior medial, and posterior medial. Apex is directed downwards towards the neck. The retromandibular vein and facial nerve emerge from the apex. So apex is directed downwards towards the neck. The retromandibular vein and facial nerve emerge from the apex. Base is related to the external acoustic meatus. Auriculotemporal nerve, superficial temporal vessels emerge from the base. So auriculotemporal nerve and superficial temporal vessels emerge from this base. The superior-lateral surface is related to the skin, platysma and parotid fascia. The anterior medial surface is related to the posterior border of the ramus of the mandible with masseter muscle outside and medial pterygoid muscle inside. So, when we are describing the pyramid-shaped parotid gland, it is a inverted pyramid shape, whereas the apex is directed downwards towards the neck. The retromandibular vein and facial nerve are emerging from the apex, whereas the base is related to the external acoustic meatus. The auriculotemporal nerve and superficial temporal vessels emerge from the base. Superior-lateral surface is related to the skin, platysma and parotid fascia, whereas the anterior medial surface is related to the posterior border of the ramus of the mandible with masseter muscle outside and medial pterygoid muscle inside. Of course, here we are showing just the parotid gland which is present just below the external acoustic meatus and extending into the neck, and of course anteriorly it is extending onto the masseter muscle, and from its anterior border the parotid duct is emerging and going into the mouth to open at the upper second molar tooth. Okay, now the apex. The apex overlaps the posterior belly of digastric, appears in carotid triangle. So here we are showing the apex is overlapping the posterior belly of digastric and appears in the carotid triangle. Structures passing through the apex are cervical branch of the facial nerve, then the anterior division of the retromandibular vein and formation of external jugular vein. So this is the anterior division of the retromandibular vein, and this is the posterior division along with the posterior auricular vein form the external jugular vein. So in the apex we are seeing the cervical branch of the facial nerve. This one is cervical branch of the facial nerve. The retromandibular vein is dividing into anterior and posterior parts. The posterior retromandibular vein is joined by the posterior auricular vein forming the external jugular vein, whereas the anterior retromandibular vein is joined by the facial vein forming the common facial vein. Base. The base is concave and related to the external acoustic meatus, posterior part of the temporomandibular joint. So this is external acoustic meatus and posterior part of the temporomandibular joint. Structures passing through the base are temporal branch of the facial nerve, superior temporal vessels and auriculotemporal nerve. So structures passing through the base are temporal branch of the facial nerve, superior temporal vessels, auriculotemporal nerve, and anterior medial surface deeply grooved by the ramus, and its relations are posterior inferior part of the masseter. So this is the masseter is related to the anterior medial surface, and then the posterior border of the ramus is itself related to the anterior border, whereas the medial pterygoid muscle is also related to this anterior medial surface. And then we are seeing the branches of facial nerve in the anterior medial surface, and of course finally the maxillary artery. So in the anterior medial surface, the parotid gland is related to the posterior part of the masseter muscle, posterior border of the mandible, ramus of the mandible, and then the medial pterygoid muscle, and then the branches of the facial nerve and maxillary artery medial to the neck of the mandible. So these are the 5 relations of the anterior medial surface of the parotid gland. The posterior medial surface is related to the mastoid process and styloid process, with the muscles attached to them, and then the contents of the carotid sheath. So here, this part we have removed the parotid gland, and the posterior medial surface is related to the first is the mastoid process, and mastoid process is having the attachment of the sternocleidomastoid muscle and also the posterior belly of the digastric muscle. So mastoid process and sternomastoid muscle and posterior belly of the digastric muscle. And then it's also in relation to the styloid process, which is having the attachment of muscles like stylopharyngeus, styloglossus and stylohyoid muscles. So here we are having stylopharyngeus, stylohyoid and styloglossus muscles. And then the carotid sheath is also in relation to the posterior medial surface, wherein we are having the internal jugular vein, internal carotid artery, then we are having glossopharyngeal nerve, accessory nerve, vagus nerve, hypoglossal nerve. That means 9, 10, 11, 12 nerves. We are having 4 nerves and internal jugular vein, internal carotid artery. So we are having 4 nerves and 1 artery and 1 vein in the carotid sheath, which are forming the posterior medial relation of the parotid gland. So the parotid gland on its posterior medial surface, so this part, posterior medial surface, is related to the mastoid process and the muscles attached to it. The muscles attached to it are the sternocleidomastoid muscle and posterior belly of the omohyoid muscle. Posterior belly of digastric muscle, sorry. Posterior belly of the digastric muscle and sternocleidomastoid muscle. And we are having styloid process, which is having attachment of the stylopharyngeus, styloglossus and stylohyoid muscles. So styloid process is having attachment of the 3 muscles. And then we are having the carotid sheath, wherein we are having the internal jugular vein, internal carotid artery and 9, 10, 11, 12 nerves. That is the glossopharyngeal, vagus, spinal accessory and hypoglossal nerves. All these are the posterior medial relation of this parotid gland. Anteriorly we are having the masseter muscle, the middle pterygoid muscle, the ramus, then the facial nerve and the maxillary artery. Very easy. The terminal branches of the facial nerve, parotid duct and transverse facial artery emerge from the undercover of the anterior body. Okay. Anteriorly, we are seeing the terminal branch of facial nerve, that is the temporal, the cervical, the okay, come on. So there are about 5 branches of the facial nerve that are coming from the under surface of the anterior border, and then facial artery is also emerged from the anterior border. The structures inside the parotid gland are facial nerve and its branches, retromandibular vein, external carotid artery and its branches. So here we are showing the branches of the facial nerve. We are having the temporal branch, the zygomatic branch, the upper buccal branch, lower buccal branch, cervical, marginal mandibular, cervical. So we are having about 5 branches: the temporal branch, the zygomatic branch, buccal, upper and lower buccal branch that are separated by the parotid duct, and then we are having the marginal mandibular branch and cervical branch. So these are the 5 branches of the facial nerve. So the zygomatic branch, then before the zygomatic branch we are having temporal branch, then zygomatic branch, upper buccal, lower buccal, the marginal mandibular and cervical branch. And then the posterior surface, posterior border is related to the posterior auricular branch of facial nerve and posterior auricular branch. So that's how the anterior border is related to the branches of the facial nerve, the facial artery and the parotid duct, whereas the posterior border is related to the posterior auricular branch of facial nerve and posterior auricular vessels. So that's about the various relations of the parotid duct. Then a parotid gland. Now we come for the parotid duct. It's about 5 centimeters in length, emerges from the anterior border of the gland and proceeds forwards and opens in the mouth opposite the crown of the upper second molar teeth. So parotid duct is about 5 centimeters in length, emerges from the anterior border of the parotid gland, proceeds forwards and opens in the mouth opposite the crown of the upper second molar teeth. So parotid duct is 5 centimeters in length, emerges from the anterior border of the gland, proceeds forwards and opens into the vestibule of the mouth opposite the crown of the upper second molar teeth. Nerve supply of the parotid gland, secretomotor, parasympathetic fibers are derived from the glossopharyngeal nerve. So, nerve supply of the parotid gland, secretomotor fibers are derived from the glossopharyngeal nerve. Structure of the ciliary gland. It is covered by a capsule made of collagen fibers which penetrate the gland as septa and divide it into number of lobules. The serous acini are round in shape, lined by pyramidal shaped cells. The nucleus is round and placed towards the base. The apical part presents eosinophilic granules. Ducts are seen between the acini. So here we are showing the parotid gland, the sublingual gland, submandibular gland. Three glands we are showing, and of course their relation to the mouth. Now, the submandibular gland is a mixed type of gland, contains both serous and mucous acini. The gland is walnut shaped, situated in the submandibular fossa of the mandible. The gland indents the posterior border of the mylohyoid muscle. Submandibular duct opens into the floor of the mouth on each side of the frenulum of the tongue. So, submandibular duct I have shown already the opening of the submandibular duct in the ventral surface of the tongue. Sublingual ciliary gland is situated in the floor of the mouth between the mucous membrane and mylohyoid muscle. It is a mucous gland. The parotid gland is a serous gland, whereas submandibular gland is a mixed containing both serous and mucous acini. So, parotid gland is serous, submandibular gland is serous and mucous mixed, and sublingual gland is mucous. So here we are showing the submandibular gland divided by the mylohyoid, supramylohyoid part and inframylohyoid part. That is sublingual gland. Then the sublingual gland is higher above, below the tongue itself, whereas parotid gland is on the outside. So that finishes our class. Just to review. So introduction to GIT, digestive system consisting of gastrointestinal tract and many glands associated with digestion. It extends from mouth to anus, and it is a epithelio-fibromuscular tube, and extending from the mouth to the anus. Its functions are deglutition, that is, the food that is taken into the mouth is first masticated. That is, it is made into very, very minute pieces and made into paste-like thing. And then this is by the action of the tongue and teeth, and here is broken into small pieces, and then it is mixed with the saliva, so that the digestion starts in the mouth itself. Then, as it is made into minute particles and like paste-like things in this other thing, it is pushed into the stomach through esophagus, and in the stomach there are various enzymes along with acid which acts upon these things, and then here the digestion is continued, and still further lower it is the duodenum, jejunum and ileum, the small intestine, where the secretions of the liver, the pancreas are added in the duodenum, and the secretions of the small intestine are added in the small intestine, and the procedure of digestion is a continuous process. Whereas at the same time absorption also takes place. The absorption starts in the stomach. In the stomach, few medicines and what do you call the water are absorbed, whereas as we go down in the duodenum and small intestine, the digested food material that are absorbed and into the blood, and they are carried to the liver where they are converted into stable form and sent to the sites of storage and utilization. And of course, finally, in the large intestine, the remaining part of water is absorbed, and the residue is stored in sigmoid colon and expelled whenever the suitable environment occurs. So, the parts of the digestive system are the you have to by heart these things are the first one is the oral cavity consisting of the tongue and teeth, then pharynx, esophagus, stomach, the small intestine, duodenum, jejunum, ileum, the large intestine wherein we are seeing the cecum, vermiform appendix, ascending colon, the hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, rectum, and anal colon. So I will show the figure. See here, we are not seeing the mouth, but we have to mention the mouth with teeth and tongue, then the esophagus, then the stomach, the duodenum, the jejunum, ileum, and the large intestine consisting of the cecum, sac-like cecum, then the appendix, vermiform appendix, then the ascending colon, and this junction we are calling as the hepatic flexure, then the transverse colon, then again junction we are calling as the splenic flexure, and then the descending colon, the sigmoid colon, the rectum, then the anal canal and anus. So these are the about 20 parts of this small intestine which you have to mention when you are asked. Then each one, the oral cavity is divided into outer vestibule, which is a narrow space between the lips and cheek, outside the gum and teeth inside. See, the oral cavity is divided into outer vestibule. So the vestibule is bounded by lips and cheek outside and gums and teeth inside. So in the morning we use this place to clean our teeth. The parotid duct opens into it opposite the crown of the upper second molar tooth. The vestibule is lined by the mucous membrane. So here this part we are seeing the vestibule. See, the lips are closer, the space between the lips and the teeth and gum. And of course here we are seeing the cheek and the space between them. This part we are calling it as vestibule, and for teeth we are showing the two incisors, canine, and of course premolars and molars. So here we are seeing the parotid duct coming and opening at the crown of the second upper molar teeth. Now oral cavity proper, it is bounded anterolaterally by the teeth and gums and the ulnar axis of the jaws. The roof is formed by the hard palate and which separates it from the nasal cavity. The floor is formed by the tongue as well as the sublingual region. The gums are soft which support the tongue. Then the teeth. Teeth we have to the decidual teeth, the permanent teeth. Decidual teeth are about 20 in number and they start erupting at 6 months, and by 12 months they almost disappear. They will be replaced by the permanent teeth. Deciduous teeth are 20 in number, 5 in each, there are 2 is there, 1 canine and 2 molars, whereas the permanent teeth are 32 in number, 18 is there, 2 incisors, 1 canine, 2 premolars and 3 molars, and out of which the last molars, they are wisdom teeth, they are at puberty. Now tongue is a muscular organ situated in the floor of the oral cavity and oropharynx. It has a ventral surface connected to the floor of the mouth by frenulum, a dorsal surface which is divided into anterior 2/3 and posterior 1/3 by a V-shaped sulcus terminalis. There are 3 main types of papillae in the anterior part. They are filiform, fungiform and circumvallate papillae situated in front of the sulcus terminalis. Of course, the mucous membrane of the anterior part is supplied by the chorda tympani branch of the facial nerve. Now the filiform papillae, I told you they are bristle-like structures. They help in gripping and moving the food in the oral cavity. They facilitate mastication by molar teeth. And fungiform papillae have taste buds and salivary glands to assist tasting. Similarly, circumvallate papillae are also helpful in taste sensation. So here we are showing the figure of tongue. There is the sulcus terminalis. In front of the sulcus terminalis, a row of circumvallate papillae are there. and on the dorsum of the tongue we are seeing the filiform papillae are mostly arranged in the tip, whereas fungiform papillae are arranged on either side of the midline in the middle part of the tongue, and they are helping in taste sensation. Whereas the posterior one third of the tongue is mostly occupied by the lymphatic tissue, which are called as lingual tonsil, and then of course we are showing the sulcus terminalis, the circumvallate papillae. That means the papillae present appearing as they are present in well, surrounded by a well. And in the ventral surface, we are showing the frenulum that is attaching the tongue to the floor of the mouth, and then we are seeing the orifices of the submandibular gland on either side of the frenulum. Posterior part of the tongue is supplied by the internal laryngeal branch of the vagus. Then, of course, muscles of the tongue, intrinsic and extrinsic muscles. Intrinsic muscles are the shape of the tongue, and extrinsic muscles bring about the movement of the tongue. Genioglossus, hyoglossus, styloglossus, and palatoglossus. All the tongue muscles are supplied by the hyoglossal nerve except the palatoglossus, which is supplied by the vagus nerve. Then salivary glands. There are three pairs of salivary glands, namely the parotid, submandibular, sublingual. The secretions of these glands are carried into the oral cavity, where they are used in digesting the food. Parotid gland is the largest salivary gland, situated in front and below the external acoustic meatus. Each gland is parotid in shape and presents apex, base, and three surfaces: superficial, anterior medial, and posterior medial. So the apex is directed downwards towards the neck. Retromandibular vein and facial nerve emerge from the apex. Base is related to the external acoustic meatus. Auriculotemporal nerve, superficial temporal visuals emerge. The superior lateral surface is related to the skin platysma and parotid fascia. The anterior medial surface is related to the posterior border of the ramus of the mandible, mesenteric muscle outside, and medial pterygoid muscle inside. So here we are showing apex is overlapped by the posterior belly of digastric, appears in the carotid triangle, and cervical branch of facial nerve, and divisions of the retromandibular vein are seen here. Whereas the base is concave and related to the external acoustic meatus and posterior temporomandibular joint, and then the temporal branch of facial nerve, the superficial temporal vessels, and the auriculotemporal nerve are seen. Whereas the anterior medial surface is related to the masseter muscle and medial pterygoid muscle, the ramus of the mandible, and then we are seeing the branches of the facial nerve, and we are seeing the maxillary artery. Posterior medial surface is related to the mastoid process, styloid process, and contents of the carotid sheath. So mastoid process with the sternocleidomastoid muscle, and the posterior belly of the digastric muscle, whereas styloid process with the stylopharyngeus, styloglossus, and stylohyoid muscles, and the carotid sheath with the internal jugular vein, internal carotid artery, and the 9, 10, 11, 12 nerves, the glossopharyngeal, spinal accessory, vagus, and habitational nerves. Of course, the terminal branches of the facial nerve, parotid duct, and transverse facial artery emerge from the undercover of the anterior border. So here we are showing the branches of the facial nerve, the temporal branch, zygomatic branch, the superior buccal, inferior buccal, the marginal mandibular, and the cervical branch. And of course, the buccal branches are separated by the parotid duct, and there is a transverse facial artery. These are all emerging from the anterior border of the parotid gland, whereas from the and posterior auricular. So the gland is walnut shaped, situated in the submandibular fossa of the mandible. The gland indents the posterior part of the mylohyoid muscle. Then the submandibular duct opens into the floor of the mouth on either side of the frenulum. I have shown already. Okay, now sublingual salivary gland is situated in the floor of the mouth between the mucous membrane and mylohyoid muscle. It is mucous gland. So the parotid gland is serous gland. Submandibular gland is a mixed, having both serous and mucus, whereas sublingual is mucus completely. So here we are showing how the mylohyoid muscle is dividing the submandibular gland into supramylohyoid part and inframylohyoid. So that almost finishes our the introduction to GIT along with the salivary glands.